All right, welcome again, everyone, to Thursday, July 16th, 2015, the Year of the Brain webinar called Understanding Stress from a Brain Health Perspective. My name is Trix VanEgmond, and I'm the Public Educator for the Middlesex branch of the Canadian Mental Health Association. I have never done a webinar before, so I'm doing this on my own, and I hope that it will, with lots of help from Janique at the Brain Tumor Foundation, so very gratefully received that. But nevertheless, I'm kind of managing a bunch of different technical tasks at the moment. I hope it will all work out well. About me a little bit. I have been the public educator at the Canadian Mental Health Association since June of 1999. I'm one out of 8 kids from LaSalle, Ontario. I wonder if anyone knows where LaSalle is. My parents immigrated from the Netherlands, and that's the reason for my somewhat unique name. Trix is a short form for either Beatrix or Patricia. In Holland, they tend to spit, and instead of it being the soft Trish, it's Trix instead, and that's officially what my name is, Patricia. I have a bachelor's degree in history and a bachelor of education. I taught for a couple of years in the Thames Valley School District before working for a community-based brain injury rehabilitation agency. I also tutored children and adults with brain injuries for a couple of years, did the usual stints in fast food, etc., until I came to Canadian Mental Health Association in 1999. My role as a public educator is 100% funded by the United Way of London and Middlesex, and of course I'm very grateful for that. But through this funding, I'm able to provide free 1 to 4 hour workshops on issues related to mental illness, mental health, associated concerns such as addictions, grief after suicide, general suicide awareness, etc. So today our presentation is called Understanding Stress from a Brain Health Perspective. Here we go. I have included 2 handouts with today's webinar. The first is a copy of this PowerPoint presentation. The second handout is a sort of application of this presentation through a document called Introduction to Understanding and Managing Stress. The October 2014 refers to when I last updated and published that one. That particular document, a Word document, includes some paper and pencil assessments similar to what we will also see here. Feel free to use them. Also, if you have any further questions about them, you can certainly contact me as well later on. So let's start with what is stress. I can see from the audience view that it just takes a few moments for the lag to catch up. So Hans Selye, who is often considered the father of stress research, defines it as this very convoluted, a state manifested by a specific syndrome comprised of all the non-specifically induced changes within a biologic system. As I mentioned, he's considered the father of stress research, so his definition is often used. However, I think it's rather confusing. Simply put, it's our body's natural response to a changing environment. This body's response to a changing environment can be physical, it can be emotional, it can be cognitive, and it can also be behavioral. But it is not necessarily bad. Why? In the next slide, I talk about why would we talk about stress. To start with, research shows that 90% of trips to the doctors are associated or are attributed to stress-related origins, and every single illness is made worse by stress. You may notice, for example, the Heart and Stroke Foundation also does publications about stress. The Cancer Society also does publications about stress. Certainly, the mental health associations also do publications about stress. The Arthritis Association, lupus, fibromyalgia, etc. We all talk about stress because it makes whatever illness you have worse. 50% of all premature deaths result from stressful lifestyles. Women are certainly catching up to men in their age of dying. Men used to die younger than women, significantly younger, especially because of stressful lifestyles. Certainly in the demographics we see now, women are catching up to that in a negative way. 80% of industrial accidents are stress-related, and for many, the experience of stress is the beginning of a descent into more serious physical and mental illnesses. But really, why are we talking about stress? Really, why are we talking about stress? Chronic stress results in lower memory and concentration permanently. Ultimately, it results in less satisfaction in our lives, in relationships, and in poor mental and physical health. Stress hurts. What I would like to do for this moment is to launch a quick poll to rate your level of stress over the last 2 weeks. You'll see it on your screen. If you're able to respond to that, that would be great. We'll take a few moments for that to happen. Excellent. Wonderful. We'll wait about another 30 seconds to get all the responses in. Good. I think we've got them all now. And let's share the results of this. So what we see is that a significant number of us would rate our stress on a scale of 1 to 5 at 3. 67% of us would rate it as such. Some of us are more at a 2, and a couple of us are quite significantly stressed at 4 and 5. So let's go on. What this, I mean, as many of us will intuitively know, we want to manage stress in order to reduce, for example, the impact of that stress on the 4 or 5 people, as well as the 6 or 7. So we certainly know that there's many personal reasons to manage stress. What we do know is that we feel better, we are more productive, we have healthier relationships, our physical health improves. We're able to maintain a positive attitude. We feel more relaxed. We're better rested. We certainly have more confidence and self-esteem and increased ability to remember and solve problems. Many of us experience when we're managing stress well, we experience more meaning in our life, certainly greater satisfaction and more enjoyment of our life. These are all really important reasons for why we would manage stress. When we ask, I said earlier about stress, that it's not necessarily bad. So let me tell you a little bit more about that. We almost always use it in that context. So when we say, I am so stressed, it usually means that we feel overwhelmed, anxious, perhaps unable to think or move forward. We're often really stuck. However, we also need stress to motivate us, to help us engage with the world, to learn. Let's look at the impact of stress on learning. There has been research that's been done. In this next slide, we sort of see the traditional parabola, and that reflects research that's been done at the turn of the 19th century to the 20th century, so in the early 1900s, as well as replicated over the last 20 years, quite frankly, dozens of times. What we know from this is that learning and stress. If you have very little stress, so for example, we'll see on this graph the section where it says 0 for the level of stress that people may be experiencing, or very extreme levels of stress on the far right-hand side of the graph. What we know is that learning is almost nil. Being bored, being unengaged at one end of the spectrum, being the 0, or being overwhelmed, unable to think at the other end of the spectrum, both result in the same level of learning. We need moderate levels of moderate levels of stress in order to learn. Now, the difficult part for many of us is trying to find what that spot is. I call that the sweet spot. We need to find our own sweet spot because it's different for everybody. We find that there are some people that, small levels of stress for a particular event, say for example, like this, during a public speaking event, is absolutely debilitating. Other people, it's not. So it's not just the fact that we experience an event, it's how we interact with it, how we perceive it, how it impacts upon us. So I would like to ask you another poll. Do you think stress has been helpful to you, either in your personal life or in your work life? We'll take a few moments to have everybody respond to that if possible. Excellent. There's many coming in. Again, has stress been helpful to you in your personal or professional life? And I'm just about to close that poll. So about 93% of us voted, and let me share the results with you. So what we see is that 62% of us say yes. I'm glad to hear that, because it really, I mean, most often we do talk about it as a very negative thing, but it can be a very positive thing. And of course, 15% of us know, you're not alone, absolutely, and 23% of us unsure. Well, hopefully we will learn even more today to try and figure out some of that. We've talked about some initial information about stress and whether it was helpful to us in our personal life or professional life. Let's look at some other negative effects of stress in both of those areas. Physically, many people will notice that they eat more or less, they sleep more or less. They'll have things like teeth grinding, rashes, skin irritations, increased headaches, an increase in minor illnesses. We know that our immune systems go down when we're experiencing significant levels of stress. We catch every bug, we catch every flu that's going around. We are less able to fight off those particular minor assaults on our immune system. People will experience many muscle tensions, aches, restlessness, perhaps showing in foot tapping, finger drumming, other, even cognitive effects, which we'll get to in just a moment, weight change. A lot of people, when they're experiencing the negative effects of stress, will notice it in an upset stomach and sort of irritable bowel syndrome effects, perhaps constipation or diarrhea, pounding heart, accident prone, and often will use more alcohol, caffeine, drugs, and nicotine to cope with those feelings. Other negative effects of stress that we'll see in our thinking or our cognition, as well as our emotions. In our thinking, we see forgetfulness, perhaps being extremely bored, feeling dull and sort of not involved in what's going on, spacing out, have a hard time concentrating. Certainly in our attitude and our self-talk with ourselves and to others, we're typically very negative and pessimistic. We get little done at home or on the job. We have a whirling mind, perhaps no new ideas. Emotionally, we're often extremely anxious, having a lot of worries. Perhaps we have significant mood swings. It may show up in our sleep, in nightmares, in experiences of little joy, crying spells, bad temper, grumpy, and ultimately for some people that can also lead to depression. Some other negative effects of stress is many of the things that we've just described will show up in our relationships. So we may isolate ourselves, whether they're intimate relationships or they're relationships with friends or coworkers. We may feel a lot more distrustful and frustrated, less contact with friends, lonely inside of that. Some people may find that they're more apt to use people, especially as they have less sensitivity to their particular needs as well. Resentful, we might lash out at people close to us. Hide, withdraw under a clam, under a rock, as I sometimes describe it, clamming up. Certainly in physical or intimate relationships, it may also show itself in a lowered sex drive, in nagging, in irritability. Those are the common effects of stress that are often reported by people. Let's look at some of those effects and how they impact upon our brain. We know that everyday stress, as well as individual traumatic events, cause shrinkage in brain volume. So it's not only all those things that don't feel very well, it's also actual brain shrinkage. This is especially true in the gray matter of the prefrontal cortex. The prefrontal cortex is a region in our brain that's responsible for self-control, so things like impulse control, and that could be behaviorally as well as verbally. It's also responsible for emotions and physiological functions such as maintaining proper glucose and insulin levels. We'll often hear about, through, for example, the Canadian Diabetes Foundation, about the need to also manage stress. Very obviously, their glucose and insulin are negatively affected by stress. So this is true, this shrinkage in brain volume, this is true for people who've gone through traumatic or stressful events in their lives, including divorce, death of a loved one, loss of a home, or loss of a job. But it could be a long time ago, but it's also people who've had recent experiences of stressful or traumatic events. So they'll also have smaller gray matter. What we do know is that many of them will have this experience where it may have been in the last 2 months, and we already start to see that their gray matter is smaller. So what does this mean? As nerve tissue in the prefrontal cortex disappears due to the constant battering from stressful events, our ability to control our impulsive behavior might decrease. And what I mean by that is we have less ability to counteract our desire to use some of the negative methods of managing stress. So, for example, many of us reach for addictive substances such as alcohol, another cup of coffee, a cigarette, some more food to cope with our negative feelings that we're having. We may also show that in other impulsive behaviors like biting the head off of the person next to us, of people that we care about. So we typically may have a much harder time controlling our impulsive behaviors and do potentially emotionally and or physically dangerous things. So let's talk about some of the types of stresses that were just referred to earlier. So types of stresses, what I'm calling everyday stresses, they're still more significant than traffic jams. These everyday stresses, I'm using the Holmes and Rahe life stress scale events. So things like the death of a spouse, divorce, jail term, personal injury or illness, marriage, etc. On a scale of 0 to 100, 100 is considered the highest stress value, and 0 is considered obviously the lowest. All events have a stress value. So, for example, going through Christmas or going through a holiday celebration has a stress value of about 15. So it could be something that we think of as a very positive event, as well as things that we very apparently understand as very negative. Do note, for example, on this slide, though, that a divorce, going through a divorce, which many of us have gone through, a significant relationship breakup, is more stressful, according to this Holmes and Rahe scale, which, by the way, is very frequently used, than going to jail. Just because it's common doesn't mean that it's easy. Certainly it's extremely, extremely difficult. What we do know is that the impact of these everyday stresses on the brain has a significant impact on our emotional awareness. We found this through brain research that we've done. So everyday stresses, such as those, seem to mostly affect this area. What this means is that we seem to lose touch with our emotions and act in less appropriate or perhaps unfeeling ways to situations and in our personal interactions. Sometimes I think of this as being numb. We're just so unaware, perhaps putting one foot in front of the other, that we have just such a hard time being aware of anybody else. It's just hanging on by our fingertips. That might show in apathy, it might show in insensitivity, certainly lack of awareness of other people around us. And that's, again, reflected in the brain matter. Other types of stresses can include life traumas, much bigger stresses. So these could be things like living with a chronic condition, such as cancer, Parkinson's disease, being a caregiver to someone with such chronic disabilities, losing a loved one, particularly when it's a complex loss. So, as I mentioned, it can include the everyday stresses, which we just discussed, but typically life traumas are more complex. So, for example, when I say losing a loved one, I'm using the example here of, say, after decades, years perhaps, of supporting a family member with a serious mental health concern or addictions issue, perhaps they die by suicide. Perhaps I had been trying to help them navigate health systems, recover, grow, do all of the things that we do with people in our lives. And yes, perhaps they do die by suicide. That is an extremely traumatizing experience, not only for obviously for the person who's passed away, but for those of us that are left behind. And so it can go from what we might think of as an everyday life or an everyday stressor, common, for example, the death of your grandmother, etc., but it's much more complex than that. So these life traumas are experienced in addition to the life stress scale events as well as everyday nuisances. So we are also going to talk about everyday nuisances. One moment. What we do know, these life traumas, we'll come back to the everyday nuisances in a moment, these have a significant impact on our mood centers. They affect our ability to regulate pleasure and reward. What we do, again, know is that small gray matter in these areas are linked to depression, dysthymia, which is kind of like a low-grade depression, and generalized anxiety disorder. We might even develop post-traumatic stress disorder or acute stress disorder as a result of these life traumas. So in our brain, we are more prone to experiencing clinical depression, dysthymia, and or generalized anxiety disorder as a result of experiencing these life traumas. That's significant. Then, as I said, what about the everyday nuisances, the things that we all experience every day? So traffic jams, projects that we have to do at work, deadlines, bills, never enough money, finances, cranky renovations, who knows? So you get a new operating system at work. What about those in addition to everything else? These also have a significant effect on us. Let's look at another poll. If you had to name your biggest cause of stress, would it be in your work life, your home life, a combination of these? Would it be a physical or emotional health challenge or something else? Take a few moments if you can and vote in this particular poll. And we'll have it open for about a minute or so, and then I'll share the results. All right. We'll give it about another 10 seconds. Excellent. Thank you, everyone. I'm going to close the poll, and we'll share the results. So what I'm noticing, 92% of us voted, and that a solid third of us say it's a combination of our work and home life. Easily shared between the two. We have 18% that say it's primarily the biggest cause of my stress is my work life, as well as another 18% my home life. And then equally is a physical or emotional health challenge. And then, of course, there's always something else, and so 9% of us have others. Let's go on. So as a result of those life traumas, those everyday nuisances, as well as everyday stresses as reflected by Holmes and Rahi, there's good news and bad news for brain health. The good news is our common stresses, those everyday things of deadlines, traffic jams, the PTA asks you to cook, 3 dozen cookies for tomorrow, etc. That does not seem to affect our brain volumes. So that's excellent news. The bad news is that if you experience the other types of stresses, the regular everyday stress that Holmes and Rahi have on their life stress scale, as well as, and then, as I said, perhaps experience a life trauma, then unfortunately the effect is magnified and we're less able to cope. So not only do we have a larger effect, but we also have less ability to manage those stresses. So it's kind of interesting that those everyday things do not seem to affect our gray matter in near the same way that those other types of stresses do. But instead, if we do experience those significant stresses and the everyday nuisances, we are in trouble because we have less ability to cope and they're more significantly affected by us. More bad news. The experience of chronic stress, both large and small events, appears to negatively impact our hippocampus and the thalamic regions of our brain. This, unfortunately, results in decreased ability to store memory. Early research that also indicates that this is a permanent decrease. So for many people, for example, if you're experiencing the symptoms, if you have clinical depression and you are symptomatic right now, then what you'll find is that you actually lose about 25% of your IQ while you're experiencing the symptoms of depression. However, that comes back afterwards, what we're saying when you're no longer experiencing the symptoms of your depression. However, what we're saying with this is that if you've got basically all these three types of stresses, life traumas, everyday stresses from the life stress scale, as well as daily nuisances, you're experiencing permanent damage to your ability to store new memories. This doesn't come back. That's important for our brain health. But everyone goes through this, right? So let's try and put some of this into perspective. Especially we tend to compare ourselves with everybody else. So let's look at that. Email is a wonderful source of lots of different stories, and so I borrowed this from an email I received several years ago. A lecturer and an audience raised a glass of water and asked, "How heavy is this glass of water?" Answers from the audience called out ranged from 20 grams to 500 grams. The lecturer replied, "The absolute weight doesn't matter. It depends on how long you try to hold it. If I hold it for a minute, that's not a problem. If I hold it for an hour, I'll have an ache in my right arm. If I hold it for a day, you'll have to call an ambulance. In each case, it's the same weight. But the longer I hold it, the heavier it becomes." He continued. And that's the way it is with everyday stressful events. If we carry our burdens all of the time, sooner or later, as the burden becomes increasingly heavy, we won't be able to carry on. As with the glass of water, you have to put it down for a while and rest before holding it again. When we're refreshed, we can carry on with the burden. Also, like the glass of water, some of us can carry it for a short time, and some of us for a longer time. It is nothing about the glass of water that is different. We are the ones that are different. Just because everyone holds a glass of water, it's not somehow the same. So for a moment, then I want to talk a little bit about managing stress, some short and long-term techniques. So we all use different types of techniques. We need both of them, short and long-term techniques, in order to reduce the negative impacts of stress on ourselves. Some examples of short-term techniques can include things like taking a break, looking away, divert, distract yourself. I had a colleague who used to say when there was bad things happening at work, just look away, so that you don't want to respond to it. Certainly, things like short, deep breaths to slow your reactive and impulsive response. You might want to say something, to do something, to act in ways that show the other person just how upset you are by their particular behavior. The breaths can help us to manage those particular behaviors. Venting to the mirror, or perhaps even to a trusted colleague. Getting a drink of water, eating a healthy snack. It's a version of taking a break, diverting and distracting yourself. Asking yourself, will this matter next week? And putting the stressor in perspective. And et cetera, et cetera. I imagine many of us have lots of short-term techniques. Certainly that there, things we'll talk about, I'll watch a short video, a joke, etc., that will try and lighten my mood to counteract what I've just gone through. Those short-term techniques are only meant to be that. They are not something, if your whole stress management regimen is short-term techniques, you're going to be in trouble. So we want to also learn and apply long-term techniques in order to manage our stress. So these include things like taking care of the basics, such as our sleep, relationships, physical activity, diet, monitoring our symptoms of stress, so seeing what we talked about earlier with the effects of stress. Some of these are things like aiming for a consistent 5 or more hours of sleep per night. That's a very standard one. Sleep is one of the first symptoms of stress to go for many of us, that when we're experiencing stress, we have a hard time falling asleep or a hard time staying asleep. But it's also the cure. So for many of us, getting a good night's sleep really does fix many problems. It really does give us the cognitive ability to handle some of the stresses that are going on, to think about them, to consider them, perhaps to solve them. Additionally, eating breakfast. This sounds so stupid, but it's something that researchers have found that when we look at people that have aged quite successfully, so we're talking about octogenarians, people that are in their 80s, 90s, and perhaps over 100 years of age, and what's the one thing that's most in common with their physical health and their mental health. And there's been some research that shows that up to something like 75,000 people over the age of 80 were surveyed to find in common what it was that they possibly had done. And the number one thing that they do is eat breakfast. So what breakfast offers is that, for example, also people who tend to eat breakfast also tend to eat regular meals throughout the day, versus those of us who skip breakfast. We tend to perhaps start eating late in the afternoon or in the evening, eat one meal, and then just keep going, and it's not very good food for us. That's really bad for our physical and mental health because we need glucose. We need regular sugars in order to think, to interact, to physically be able to move, etc. So when we eat breakfast, this results in a much healthier lifestyle. So of course, physical exercise is one that we always hear about, but it's to the point of sweating. And usually we need to do it for more than 20 minutes every 2 days. This helps not only to our physical systems, but it also helps to reduce the cortisol levels in your brain, which is a stress hormone. It's produced when we are stressed. But you have to get to the sweat point. So, for example, if every day you walk to the bus and then over time you're walking a kilometer, 2 kilometers, etc. But if you don't get to the point of sweating, you don't reduce the cortisol levels in your brain. So it could be like my mother, who would walk 200 yards and she'd be sweating profusely. Or, for example, me, I have to do a 5K walk or something like that in order to sweat profusely. We need to get to that point in order to have the positive long-term effect on our stress. Additionally, a long-term technique is to cultivate relationships that are good for us, learning to manage those that are not so good for us. Sometimes that's easier said than done. Certainly that's something that I'll talk about a little bit later on, because these long-term techniques may not just be something that we can will ourselves to be able to do. Some other long-term techniques is looking at things, for example, monitoring our intake of negative substances such as alcohol, junk food, caffeine, nicotine. We tend to reach for these when we're stressed, but they should be used moderately. Certainly as a long-term solution, they're not, and they may worsen our situation. Monitor our other behaviors that might also be associated with your negative stress responses. So, for example, you might tend to clam up or go to sleep immediately when you're stressed, or have a very nervous stomach, or easily irritated. You might find that you have certain stress habits that you do. I used to twirl my hair and scratch a spot on my head. And I now have a gray streak in that particular spot, as well as all over. But nevertheless, whatever your nervous habit is, and I'm sure you know what it is. It could be something like biting your nails, like scratching your head. When you're experiencing negative stress, monitor these things. Get to know yourself better. For many of us, we might also consider using a version of mood trackers, journals, etc., in order to keep track of many of these effects or many of these things that we might do. So, for example, findingoptimism.com has some wonderful things. It's sort of you write down, there's an app that you can put on your phone as well as on your desktop computer that will say things like, how many hours did you sleep last night? Did you exercise in the last 2 days? Was there a significant life event? Did the cat die? Did the car break down, etc.? That would have resulted in an impact upon your sleep. Did you eat regularly today? What was the quality of your food? What were your nervous habits? Did you do them? Rate your anger or your irritability level. Rate your anxiety level. These can really help us to increase insights in order to apply many of the long-term techniques for managing stress. Certainly learn and regularly use relaxation techniques such as progressive relaxation, meditation, visualization exercises. I was not a large proponent of these years ago because I quite frankly found them very frustrating. Then I learned that they're a bit like a muscle. You have to practice them to get better at them and for the relaxation effects to actually work. So if you're a beginner, for example, to these particular techniques, I would suggest you start with something like progressive relaxation. You can always contact me at the Canadian Mental Health Association. I have samples of CDs that I can certainly lend to you or suggest to you. Those are a good way to start to build that relaxation muscle. Certainly there's a number of different types of meditation, mindful meditation, calming breath, etc. And there's many different organizations that will also teach you to do that, usually for a fee, or you can try and, of course, do it at home. It has an incredibly positive effect on bringing down your autonomic responses, so bringing down your respiratory rate, bringing down your heart rate, and ultimately reducing the cortisol levels in your brain. So these are very, very effective. Perhaps in the long-term techniques you go through all this and you realize that you are very negatively affected by issues that aren't so easily resolved, as through exercise and good sleep. Yes, I'm sleeping well and I'm eating well and I'm exercising, but I'm still incredibly stressed. So for these situations, which I'm sure many of us go through, you might need to consider an investment in yourself through activities such as financial advice. Perhaps that's a major source of your struggles. Personal development courses, that could be things to deal with self-esteem, assertiveness training, anger management, personal life coaching often sort of combines many of these. Couple counseling, perhaps that's a significant source of your stress. Cognitive behavior therapy. In order to, perhaps you are someone who has been put in or has been using certain patterns of thinking and you don't even realize that they're negatively impacting you, and certainly even how to get out of them. So for example, there's in cognitive behavioral therapy, we'll often talk about catastrophizing or all or shoulds, that we do this to ourselves, and it increases our level of stress and our expectations of ourselves as well as other people, and it causes a lot of distress. Certainly other things maybe that we have to deal with substance use or abuse groups, or we have to deal with those issues, and we might be doing that through groups. We might do that through one-to-one counseling as well, but there certainly are a number of different services that are available in order to help us go on that particular journey. Perhaps for a support person for people who are struggling with substance use. Then there's also the types of self-help or peer support that can help us too. And that's kind of implied by the last bullet. The other types of counseling are psychosocial support, maybe peer support groups, it may be spiritual development, etc. These are all some of the long-term techniques that we can use to try and manage our stress better. I'm just waiting for the next slide to move forward. In just a moment. It's getting there, I think. Here we go. Remembering that stress hurts, and it has a long-term negative impact on your brain health, and on your physical health. Remember that your mental health matters. I have another particular poll that I wanted to ask you. And let's see if this, as we're getting to the last few minutes and about to close, I'm wondering if today has resulted in any concept that you might try to use some different methods, or not really, I already knew all this sort of stuff. I guess my big point is that sometimes we look at our levels of stress as being a bit of a trophy. I must be so important, or someone so important because they have so much stress. It's not a trophy. Not only does it hurt while we're going through it, but it causes long-term damage to your brain. And it's not worth that, aside from your interim experiences. So I'm going to leave the poll open for about another 10-15 seconds, and then I'll share the results on that. Remember, if you do have any questions, feel free to put them on there in the right-hand side. You're able to ask questions there. And of course, if there are none, or if I'm not able to get to questions, then we'll certainly, I will respond to them afterwards. So now I'm going to close the poll and get ready to share it with you. So here we go. As expected, about 83% of us voted. 70% of us, not that part I'm not expected. I'm glad to hear. Good. 70% of us are considering that maybe I will do something more as a result of this this discussion today about my stress. Maybe it reminds me that I really do need to do something about this. And 30% of us know I was already well informed. Thank you so much. Oh, sorry. I thought I hit share there. I didn't. And so now you will see the results that you had put on there and I just mentioned. Okay. Okay, so that was that particular poll. What I would like to say is thank you for your participation. I really appreciate that you dialed in today. If you do have questions, there are none on this particular dashboard right now, which is absolutely fine. But if you do have any questions after the event, you can certainly contact me at the Canadian Mental Health Association. I'm at the Queens Ave site. We have many different sites. And in our next slide, I will describe a little bit about that. Just simply that the Canadian Mental Health Association, the Middlesex branch, does cover a wide variety. Let me just, sorry, I'm just trying to close this. And here we go. So the CMHA Middlesex has offices in London, in Strathroy, in Exeter, Goderich. You can certainly find out more about our programs at cmhamiddlesex.ca. We have amalgamated about a year and a half ago with 2 other organizations, so we are really, really very large right now, and so as a result, the old CMHA London Middlesex may be a beast that you know. We're much different than that beast now. I'm not saying that it was a negative thing by any means, I don't mean that, but simply that we are a much larger organization, and as a result we have many, many more programs in a much wider breadth. Please feel free to contact myself or to go to our website in order to find out more information. Thank you everyone, and I will check questions once again just to be sure. Nope, there's nothing there. So thank you so much for your time. I appreciate that you are all here, and I hope you have a lovely day. Thank you.